Hi students, my name is Riley Scroggins. I'm a graduate degree nursing student from Auburn University. I've been working with Dr. Joslin this semester, and I've probably seen some of you in class or in clinical, and some of you have even had this lecture particularly in person. But Dr. Joslin wanted me to also make a recording of it for those of you who were not able to be there in person that day, and also for future students possibly. So I want to go over NCLEX preparation with you, and you're in your final semester and you're getting close to taking the NCLEX, and now is really the time that you need to be getting yourself prepared for studying and for practicing these tests to take the NCLEX. So this is just a little meme I thought was funny. The NCLEX exam where every answer is right, but only one answer is more right than the others. So first, just like an overview. I'm sure you're already familiar with what the test is going to look like. We'll just talk about it real quick. The test format is, it's an adaptive test. So what that means is when you answer a question, it is going to adapt the test to how you answer that particular question. So if you answer a question wrong, it's going to give you a little bit of a lower level question. If you answer it right, it's going to give you a little bit of a higher level question. The one thing I will say about this is when you're actually taking the test, I don't want you to be too focused on this, because you can kind of get in your head and think, oh, well, that question was super easy, so I must have answered the last one wrong. And that's not what you should be thinking about while you're taking your test. So I want you to be aware that that's how the test is, but at the same time, I don't want you thinking about it too much while you're actually testing. So you can have anywhere from 75 questions to 145 questions, and you have a time limit of 5 hours total. And each particular individual question does not have a time limit. So you can spend as much time as you want on a particular question, but you have to think, I need to pace myself for possibly taking the full extent of the test. The entire 145 questions is what you need to be mentally prepared for. So with that in mind, you don't want to, on the first 5 questions, take 10 minutes on one question. So just keep that in mind to pace yourself. So here's all the different types of questions that you can get: multiple choice, fill in the blank, calculation, hotspots, exhibit, ordered response, audio and graphics. If you have a question about what one of these question types means, I'm not going to go over each one specifically. So if you're like unsure what does a exhibit question or a hotspot question mean, I encourage you to look that up online. You can find good resources for that. So this is just talking about the passing standard. It's reevaluated every 3 years. There's no fixed percentage. It's the passing standard indicates the minimum level of ability required for safe and effective nursing practice has been met. So here's just an overview for you to look at of the testing content. And this is actually from the NCLEX's test plan that was published in 2019. And these percentages, since it's an adaptive test, these percentages can be off plus or minus 3% each, but it gives you a really good idea of what you're looking at. So if you want to pause and look at this, I'm not going to talk through each one. You guys can look at it. So a big question that a lot of people might ask is, when should I take the test? How long after I graduate should I take the test? So you guys can look at this data here of people from, this is the day they graduated until they take the test. So overall, people who took the test 0 to 21 days after graduation had a 79.7% pass rate. People who took it 22 to 33 days, 80.9% pass rate. And then you can just see it go down pretty significantly from there. The average person, I believe, takes it 45 days after graduation. I want to encourage you, I think 1 month is a really good kind of goal for you to shoot for is 1 month after graduation, because you should be starting your preparation and your practice now before you even get to graduation. And so once you're graduated and you give yourself a few weeks to a month, that should be enough time to get you prepared to take the test. As you get further away from graduation, obviously you're going to start losing the content. You're going to start kind of getting out of test mode. And that's when you see these pass rates like plus 55 days after graduation have gone down a lot. So we don't want to be in that group. So when it comes to your preparation schedule, you guys need to make a solid schedule. Your schedule should include what days you're going to take practice tests, what days you're going to remediate those practice tests. I'd encourage you to consider an 8 to 12 week schedule. So although you're not going to be able to actually schedule your exam quite yet, go ahead and have in your mind what few days, like what time frame you're going to take it in, and then go ahead and create a schedule for yourself, ideally 8 to 12 weeks out from whatever that time is that you choose. I want you to make a feasible schedule, so don't have yourself taking like 10 75 question test banks in a day. That's too much. So be realistic here so that you can stick to your goal. You need to be organized and have good time management. I know in your last semester that this is not the only thing going on in your lives. You have exams you're taking, you're trying to finish clinical hours. A lot of you have families and spouses and children that you have to take care of. And so you need to be super organized. You need to set aside specific time to study, and this time should be totally uninterrupted. So when you sit down to take these practice exams, it shouldn't be at the dinner table also helping your kids with homework. You need to get yourself in a testing environment. So we're going to have to be super, super organized to be able to get this done in time. So study tips, I kind of already went over some of this. You should not be taking practice tests that have less than 75 questions. A huge part of the NCLEX is just knowing how to answer test questions and being able to test well. You guys have been through nursing school and you know the content. At this point, the content should be totally there. You might have to refresh a few things, but in general, this study time is going to be directed towards taking practice tests and working on how to answer these questions, how to read NCLEX style questions, and how just to increase your endurance and your stamina to sit down and take a really long test. So I want to encourage you not to content cram. Don't be pulling out all your old textbooks trying to read every single page. That is not going to be helpful for you and your success with the NCLEX. I remember being in your shoes, and I remember starting my last semester of nursing school, and all of our professors and my advisor told me, you just need to be taking practice tests at this point. And I remember I had such a hard time believing them because I felt like from the previous semesters, there was so much content I needed to freshen up on. But I found out that they were right. And I remember after I took the NCLEX, I took it before some of my friends, and they kind of asked for some advice. And I remember telling them, just focus on taking practice tests. Don't be in the content going crazy like you did when you crammed for an exam in nursing school. You need to be practicing taking the tests. So I want to give you some helpful tools for how to tackle NCLEX style questions. So the first tool, and this is from Kaplan, which I know you guys use ATI, but Kaplan has some really good tools. So this is Kaplan's nursing decision tree. So before we even do this tree, I would encourage you, when you are taking the test, to when you're reading the question, I want you to take your hand and cover up all of the answer choices. So you read the question and come up with in your mind what you think the answer should be. And then you're going to take your hand off and see was the answer you came up with close to one of the answers on there. Then, so step one of this tree, I want you to identify the topic of the question. So the NCLEX sometimes can be tricky. They can throw in information that's not the main idea, the main topic of the question, just to throw you off. So you need to identify what's the topic of this question. What are we really talking about? Are we talking about a drug? Are we talking about like some kind of nursing implications? What is it? Then I want you to look at the answer choices and see, are these assessment or implementation answers? And you need to think about your question and think, does this situation warrant further assessment before I do an implementation? Because a lot of times that's going to help narrow down your question really quickly. If you see from the root of the question, hey, we kind of need to know more about what's going on with the situation before we can just implement, then you're already going to know, okay, we're looking for an assessment answer. Step number 3, apply Maslow. So are the answers physical or psychosocial? When it comes to NCLEX, you are always, always, always going to be meeting physical needs before psychosocial needs. So if you look at your answer choices and you see a few psychosocial in there, but there's also physical, you can toss out the psychosocial. That there's a physical answer in there, it is not the psychosocial answer. Then you want to look, are the answer choices related to the ABCs? So we know this, airway, breathing, circulation. Those are going to be priority. So if you're a little bit tied up and you're like, I'm between 2 answer choices and I'm not really sure, I want you to go over the ABCs. Are one of them airway, breathing, and circulation? And if one of them are and the other one's not, then we're obviously going to choose our ABCs first. If you've gone through all these steps and you still are not narrowed down to one answer, I want you to think, what is the outcome of each of the remaining answers? So if I do this, if I see this person first, what's the outcome going to be? And then you're going to choose the one with the most desirable outcome. So here's a practice question for you guys to look at, and we'll try to use the decision tree to help us come up with an answer. So the nurse administers glipizide 5 milligrams before breakfast to an older adult client. At 10:30 a.m., the client reports headache and hunger, and the nurse notes the client is irritable. Which action should the nurse take first? So we're looking at a priority question here. So our options are 1, contact the physician, 2, offer the client half a cup of fruit juice, 3, tell the client that lunch will be served at 11 a.m., and 4, suggest the client go for a walk. So by using our decision tree, first we want to know what's the topic of this question. And the topic is hypoglycemic agents, so glipizide. So we already know based off the topic, what are we worried about? Our patient having hypoglycemia, which they're reporting a headache and hunger. So that is definitely what we're concerned about. Now we want to think, are these assessment or implementation answers? And they are all implementation answers. So that doesn't help us at all. Then we want to think, what are these physical or psychosocial answers? The only one that is psychosocial is suggest the client go for a walk. That's suggesting that they need to clear their head. And so that is not a physical answer, it's psychosocial. So we can go ahead and toss out option 4. Then the ABCs, that doesn't help us here. So lastly, we want to think, what are the outcomes going to be of each one? So the outcomes, we contact the physician, nothing is going to immediately be solved for our patient. We're just passing the buck here, which another NCLEX tip for you If one of the answers is passing the buck and just having someone else deal with the problem, that is not the answer. So we can toss this one out. Let's jump down to 3. If we tell the client that lunch will be served at 11 a.m., what's our outcome going to be? Well, this patient's probably going to get more and more hypoglycemic, and we might run into a serious hypoglycemic crisis here. So we're going to toss that one out. So the correct answer is 2, offer the client half a cup of fruit juice. So that's just an example of how to kind of go through the tree. And I wanted to give you this example because in this one we had to go all the way down and use the entire thing before it really helped us. So another type of question you're going to see is who do you see first? Which patient are we going to see first? So I want you to think kind of through these. Which patients are unstable, which are stable? Obviously, that's going to help us weed out some answer choices usually. So if they're stable and we have an unstable choice, the unstable choice is going to be first. Is our patient experiencing an unexpected or expected side effect or outcome? If it's unexpected, that's who we're going to see first. Expected can wait. Once again, the ABCs, are any of these patients having issues with airway, breathing, or circulation? Those are going to be priority. Are they acute or chronic issues? Acute is going to be the priority. And then is it an actual or a potential problem? So are we having a patient who's actually crashing, or do we have a patient who has maybe a lab result that we're a little bit concerned about? We're going to go for the actual patient is crashing issue. So here's a question for you guys to look at. I'm going to let you just read over this one real quick. Okay. So here you're going to see the correct answer was number 1, the 41-year-old male taking methylphenidate with a blood pressure of 180 over 110. Why? Because we looked through all of these, and first of all the other patients are stable, and this guy is not stable. He has a super high blood pressure. He's unstable, so we're going to see him first. Just kind of going through number 2. We have an expected outcome and they're stable. Number 3, we also have an expected side effect and they are stable. And number 4, again, we have an expected side effect of the rash from amoxicillin and they're stable as well. Another type of question you're going to get is delegation questions. So what can we delegate to the UAP or the LPN? And they're going to try to trip you up on these questions. So some rules here. Nurses cannot delegate assessment, teaching, or nursing judgment questions. Assignments, I'm sorry. So if one of the options is obviously says assess something or is going to require the person that you're asking, that you're delegating something to use nursing judgment or to teach a parent or a patient about something, that cannot be assigned to them. So with LPNs, we're going to assign stable clients with expected outcomes. For UAPs, we're going to delegate standard unchanging procedures. So here's this practice question here. So you've got a nurse on a pediatric floor. They've got multiple patients, and we're going to see which of the following assignments can the nurse delegate to a UAP. Select all that apply. I'm just going to go ahead and go down here. What can we assign? We can get them to take a blood pressure for the 12-year-old. We can have them empty the Foley catheter bag of the 16-year-old. Those do not require nursing judgment. They do not require teaching. They're standard unchanging procedures. Number 2, the reason that's incorrect is because we're asking them to make an assessment, which they cannot do. And number 3 is incorrect because we're asking them to teach a parent something. We cannot delegate teaching. We cannot delegate assessment. Another type of question that we need to be aware of how to answer is therapeutic communication. So these can be a little bit tricky for us because we like the black and white textbook answers, and these can trip us up a little bit sometimes. So some tips is we want to focus on the client. We want to use silence, use presence. So saying, I will stay with you a while, or just sitting there, being present, being quiet, focusing on the client, not talking about yourself, not changing the focus to you as the nurse. You can provide information, validate feelings, and never, never, never are we going to ask why, because that is questioning why they're feeling that way, and that will make them feel not validated. So you never want to do that. So here's a sample question. We have a 17-year-old pregnant female who is laboring in the labor and delivery unit. The patient says to the nurse, I'm all alone and terrified. No one is here for me or my baby. What response by the nurse facilitates therapeutic communication between the patient and the nurse? So go ahead and flash the answer for you guys here, but we're going to go over them. So first is, I completely understand how you feel. I delivered my first under similar circumstances. Incorrect. The nurse here is shifting the focus to herself and making it all about her. And we know that that is a big no-no in therapeutic communication. 2, why don't you have anyone with you? First of all, that sounds super judgmental. And second of all, we're not supposed to ask any why questions. 3rd, don't worry. We're going to take such great care of you and your baby. You're in wonderful hands here. So this is a little bit tricky because this seems like that could be possibly a good thing to say. But the issue here is that it's very dismissive. It doesn't validate their feelings. It just kind of takes what they're saying to you and just kind of pushing it to the side, saying, oh, don't worry, like just getting rid of their problem, dismissing it. So that's not the right answer. The correct answer is, this must be very difficult for you. I will stay with you for a while if you would like. It's validating their feelings, it's providing presence, it's offering to just be there and be comforting and still making it about the patient. So now let's talk about remediating test questions. So we already talked about some good tips and tools for answering test questions. We talked about how to schedule your study time. So now let's talk about, you've taken some practice tests and now you're going to remediate test questions. And I really, really encourage you to sit down, carve out time and sit down every time after you take a practice test of at least 75 questions and go over all the questions that you missed. And I want you to ask yourself, did I misidentify the topic of the question? So that's number 1 of the decision tree we went over. You need to be able to identify the topic of the question. So if you weren't able to do that, then you probably need to work on just practice reading more questions and figuring out what really am I being asked about here? What is the main topic? Did I miss a key word? If you missed a key word, or if you misinterpreted information, you probably read the question too fast. You probably need to slow down, read it a couple times. Did I read into the question? So this one's really important. A lot of times we can read the question and we can say, well, but, or what if this? And we can't come up with scenarios in our head. We can't add to the question. The question is all that is right there in front of you, the words that you're seeing in front of you. Don't read into it too much. Don't add scenarios in your mind. Just look black and white at the question in front of you. did I not know the content or not remember the content? So this is important. If you go back over the question and you're like, man, I have no idea what I did wrong, or, oh, wow, that's the answer, and I would have never guessed that was the answer, then you probably do need a little bit of a refresher on that specific content. Don't spend a crazy amount of time, but you probably need to just kind of skim back over that content a little bit. So here's some more for questions you missed. Did you read all the answer options? So for this, you may have just like read one answer option and said, oh, that's it. Or maybe you did the thing where you cover the answers with your hand. And then after you read the question, you thought of one of the answers in your mind and you uncovered and you saw a similar to what you thought in your mind answer, and you just choose it and don't read any of the other options. That's not a good thing to do. So even though I do encourage you to cover it up and think of the answer in your mind, you still need to read over all of your options that you have. Again, did you forget the content? And then did you record your answer incorrectly? So that just means you probably need to be paying better attention and not answering incorrectly. You're probably going a little too fast and need to slow down if that's the case. So another thing that we want to look at is changing answers. I know a lot of you probably know if this is something you struggle with in nursing school. So I want you to look at, did you have the correct answer and then you changed it to the wrong answer? Did you have the incorrect and you changed it to correct? Or did you change from incorrect to incorrect? If you change from incorrect to incorrect, you probably don't know the content. You probably need a little refresher. If you change from correct to incorrect, if you do that frequently, then you need to just stop yourself from changing your answer. Once you answer, like you read the question thoroughly, you spend your time on it. Once you answer the question, you should not allow yourself to change it. You need to move on to the next question. More things to think about. Did I run out of time or feel rushed? If that's the case, you really just need to do more and more practice tests to get yourself accustomed to time management. Was I able to focus without getting distracted? So this is important. I want you to think about, number one, are you in a test-like environment where there's not distractions all around you? We want this to be as much like test day as possible when you're taking this practice test, so that you can sit down and actually focus. I want you to think about, did I eat enough before I started this? Is my stomach grumbling and I'm hungry? Did I not sleep well the night before? Do I need to work on sleeping better so I can study more? All of these things you need to consider. Did you feel calm or did you feel anxious? If you're feeling anxious, I want you to practice some positive self-talk to yourself before you sit down and take the test. Maybe do some deep breathing and just think to yourself, I'm prepared, I know the content, I've studied for this, and just deep breathe so that you can kind of calm your nerves. And that is all I have for you guys. Here's my references. Thank you guys so much for listening. And I wish you guys the best of success and good luck on your NCLEX exams.